want to introduce Dr. Sunday Amosun. Media, please, can we have it here? He studied medicine and surgery at the Premier University of Ibadan, and graduated in 1997. He became a fellow of the National Postgraduate Medical College of Nigeria, Faculty of Psychiatry in 2008, and was appointed as a consultant psychiatrist in 2009 at the Neuropsychiatric Hospital, Aro. Presently, he is a consultant special grade 1 and heads at the Lantoro Annex of the hospital. He specializes in drug abuse and also heads the drug addiction and rehabilitation units of the hospital. He is involved in clinical services, training, research, and publication. Please welcome on stage with me, Dr. Sunday Amosun.
Okay. Let somebody shout hallelujah. I want to thank Daddy. I'm ever grateful, Mommy. I'm grateful, glad to be here again. I was here last year. How many of us remember me? Oh, jam your hands together for Jesus. That profile was the last year profile. I've been promoted. I'm the director of research and training now of the hospital, a member of the top management committee of the hospital. So, Moti, step up. Tell your neighbor, step up. God will step you up. You will go up. I'm to talk to you about exhaustion, how to beat exhaustion. You know, women, they multitask. If you are not careful, men will become laid back. And you know who caused it? It's the women. It's our mommies. How do you train the boy's child? How do we train them? Are we training them to say they should not come to the kitchen? If that's what you do, they will not be a good husband. So please, take note. They will not be a good husband. We want to beat exhaustion. And I say women multitask. Before going further, I'll whet your appetite about the mental health of women. Next slide, quickly. There are peculiarities about women that we need to be aware of. The percentage of women being treated for mental illness is more than men. Even in the US, globally, worldwide, in 2017, about 20% of the adult population, even in US, so it's not in Nigeria alone, globally is 1 out of 5. In Nigeria, it's 1 out of 4, so about 25%. And out of this, more than 50% are women. Next slide quickly, so that we'll rush with this. So, women are twice more than men to commit suicide. And it's not surprising. The commonest cause of suicide is depression. So if you put 10 people there down that committed suicide, it will be ratio 2-1. Before you see one man, you will have seen 2 women. Even in depression, like I said, women, they are also more depressed than men. Even the lifetime of prevalence rate of violence against women could be as much as 50%. You know the greatest problem? Suffering in silence. They don't say anything. They pretend as if nothing is wrong. Even when you see the physical sign of abuse, red eye, and there's a red eye. And daddy say, Shekosi, why is your eyes like this? She will lie. Mommy noticed it. Instead of coming out, she will lie. At least 1 in 5 women suffer rape or attempted rape in their lifetime. Women. Female gender is a significant predictor when you see those who use drug, whether antidepressants, antipsychotics, they are likely to be women than men. I hope you are following me. Women are almost 10 times more likely than men to be affected by eating disorder. They are the ones who are looking at themselves. Ṣé mi ò ti rọ̀bọ̀ jù báyìí? Ṣé ọmọ like mi báyìí? He's looking at himself in the mirror repeatedly, and he may subject himself to fasting and prayer, even when there is no need for fasting. You are the best that God has created. Tell your neighbor, you are the best. You are unique. Women wait an average of 4 years after onset of PTSD, post-traumatic stress disorder. God forbid an armed robber came into the house and he raped somebody, but you witness it. And every year when the anniversary in quote is approaching, you will have hypervigilance. You will not be able to sleep again. You have nightmares about it. There will be subtle reflex. If you hear a sound, bam, it wakes up immediately. That's PTSD. Even when that happens, men will still notice that something is wrong, and he will rush to the hospital earlier than the women. You will be surprised. Yes. No man wants to die, sincerely. Sincerely. You know, the African setting we find ourselves is patrilineal. That's why men will sit down and mommy is in the kitchen, is multitasking, and the baby is still crying. And his mommy will still stand up and put her at the back and sing, Oto Korondo, Tobaji Agbobekano. And the man will be watching NTA News. And he's there sitting down. Beshekowani. I'm not one of them. I told you last time, if you forgot, Mole Welmo Koko, not because I am a doctor. Mokowani. Yes. Tata ọ̀dẹ̀ ní sápa lórí, tómi ò ní pa lórí, ẹ̀ẹ̀kan sí bẹ́ẹ̀ ni. When they say men don't listen to their wife, ask my wife, she will say, he listens. I listens, and my life is better than those who don't listen. But better pray that they listen to you. No, sincerely. Dr. Amosun is a zonal pastor in the Redeemed Christian Church of God, and I'm going to heaven. It's a privilege to be here. I won't lie even on ordinary things, not to talk of lying on the altar. Maybe I've learned that it is good to listen to them. Unfortunately, majority don't listen, including senior pastors. Majority don't listen. There are many things we should have done earlier. Mom will say, there's often that you want to go. Many things they should have done earlier. Women may be less likely than men to seek treatment after experiencing mental illness. You know why? If he tells daddy will say, sorry, bye. Soko lo nso. Shola is on new ebini. Ojema kobara. The man may ask you to sit down, yet you are having poor sleep. You are not sleeping. He may shut you down. And you know why it's easier to shut us down? Sometimes the gap between the man and the woman is very much. I'm just 1.5 years older than my wife. Whenever I forget something and she says, Agbati day, I will say, Melo ni mo fi ju ẹ lọ. Tagbabati day si mi o ti dé sáwa méjèèjì ni. That's the truth. That's the truth. We are in the same generation. Èmi jáde school at 87, wọ́n jáde 88, the same onewa. Old school ni gbogbo àwa àjọ ṣe GSS ni. Àbí? So we are the same. So next slide, quickly, let me run. We're going somewhere. I'm going to tell us how to beat extortion. Quickly, media. Yeah. Even in drug, maybe you don't know. Women too use drug today. There's a national drug use survey for Nigeria. It looks like a prevalence of drug use in people aged 15 to 64 in Nigeria, and it was published January 2019. 1 out of every 4 Nigerian women, 1 out of every 4 that use drug in Nigeria are women. You will not believe it. If you are not careful, our children in the university, quite a number of females are using drugs and parents are not aware, including codeine contained in cough syrup, tramadol, and the likes. Some even go as far as crack cocaine, meth, that is called ice, molly, ecstasy. You may not know. You may not know. Research shows that women can become addicted to drugs even faster than men. It's called the telescoping effect of drug. If a man and a woman start using drugs at the same time, the woman will get into problem before the man. Note also, a lot of vulnerability. Women are twice as likely as men to develop depression and anxiety. If you know this background, next slide quickly, let's move on. We need to note this peculiarity before we begin to see the role of exhaustion, the role of suffering and smiling, the role of pretending that all is well when all is not well. That's why be sincere. Tell your neighbor, be sincere. Ẹjẹ́ àsòkodoro ọ̀rọ̀ àìsọ ọbẹ̀ ká kú bẹ̀ ọ̀run òdẹ̀ lè wò. It's when you say it that solution comes. Next slide quickly. Next slide. Yeah. Depression, anxiety, psychological distress, sexual violence, domestic violence, and escalating rates of substance use affect women to a greater extent than men. I've said it, across countries and different settings. Pressure created by their multiple roles. Àwọn gangan ni foreman kì í ṣe ọkùnrin. Obìnrin gangan ni foreman. Wọ́n lápọ̀nlé ni foreman ẹnìkan ò lè ṣiṣẹ́ èèyàn mẹ́rin. It's not for a woman. Obìnrin á ṣiṣẹ́ èèyàn mẹ́wàá. I know it and I celebrate them. Sincerely. What a man cannot see standing up, a woman will see it sitting. Women are futuristic and they have an intuition. If your wife says, be careful of lagbaja, you say, Kini, etuti bere. If you don't heed, something will happen. Serious. Let me apologize, my wife is not here again. Last year, we had a separate engagement. Today, as I speak now, we are in Ibadan together, but it's in UI. My sister-in-law was born June 12, 60 years ago. She retired June 11, and as I speak now, they are at UI for the family engagement. I'm going to join them when I leave here. That's why she's not here. That's why she's not here. There is also a positive relationship between frequency and severity of such social factors. All these factors, gender discrimination, poverty, hunger, malnutrition, overwork, sexual abuse, domestic violence, they combine to contribute to the poor mental health of women. And saddening, we go into denial. We pretend as if nothing is happening, and we are not better for it. So, having that as a background, what then is exhaustion? It's coined from a Latin word, exhauri, to empty out. Something is full, you now empty it out. Your energy is emptied out. Your zest, your zeal is emptied out when you become exhausted. It's a state of extreme physical or mental tiredness. Somebody is running with a vision before, now begins to slow down. Somebody who is agile before, he now begins to slow down because this person is exhausted, because he didn't have enough support. Onlonda ronu, onlonda tomo, onlonda gbe. That will lead to exhaustion. And it could be physical or mental. So they lack energy. They can't even stay awake. Sometimes when they are doing an activity, they can take a nap. Because of exhaustion. Yes, exhaustion. It also happened in somebody is driving, it's on the third mainland bridge, and suddenly he slept on the steering, or she slept on the steering, and some people have had accidents as a result. So it could happen. Extreme fatigues makes it hard to get up in the morning and to go to work. You don't feel like standing up. You are not sleeping. The little sleep you sleep, you are not refreshed. Fatigue feels like you have an overwhelming urge to sleep, yet you cannot sleep. Fatigue often occurs along with other symptoms such as lack of desire and hedonia. You are not interested in anything. Exhaustion. It's that exhaustion that had led to the lack of desire to do something. They have trouble concentrating, trouble focusing. In the process. They have a lot of nervousness, anxiety, unexplained pain, muscle pain. All this can come from exhaustion. Tired eyes. If you look at the eyes, yes, Sundada, it will be obvious in the eyes, you will see. This eyes is heavy. Amosun. Tired leg, whole body, that tiredness, agberati, exhaustion. Physical exhaustion. It's physical exhaustion. It's mental exhaustion. It drains us, and it manifests with lack of energy. Motivation. He's not interested in anything. He lacks focus and engagement. And it's often associated with mental exhaustion. Mental exhaustion is still agile, but something is wrong. He cannot think straight again. He's getting tired of life. It occurs when work takes its toll on the physical body. Nobody to help. It leads to being unhappy, unmotivated. And if you are not careful, the children will be affected. That's why you must beat exhaustion. Physical exhaustion occurs when completing manageable tasks and projects seems impossible. You start something you cannot finish because you are exhausted. You start something you cannot finish because you are exhausted. Stress versus physical exhaustion. At the bottom, somewhere there is stress. And stress is heavily influenced by how we perceive the situation. Physical exhaustion occurs no matter how we view the situation. There's a problem, even when you see it positively. Persistent stress can lead to physical exhaustion due to changes in hormonal activity. There are hormones in the body, adrenaline, cortisol, that goes haywire when all this thing happens. Next slide. They are activated. So we can have these signs: muscle pain, headache, even thirst, excessive sweating, hair loss. Here, I told us sometimes ago that even you can have hair loss, you can have premature graying. when you are going through all these stresses. Yeah. Frequent cold because your immunity is compromised. You cannot fight ordinary malaria on yourself. You cannot fight acute coryza, common cold, virus that is non-specific. So, what are the causes? Sometimes medication, usually lifestyle related. No help from the spouses. Fatigue can be chronic, lasting more than 6 months, or temporary. It could be social, psychological. They are changing course because could walk out of. Professor gba 200 ní jambu. Lápáta gba 300. Ọlọ́run mọ bó ṣe ń ṣiṣẹ́ o. Serious. Ọlọ́run mọ bó ṣe ń ṣiṣẹ́. Àwọn tí ò ní fọ́ tí ò lè kán, àwọn lọ́lọ́run máa ń gbé sókè. Àwọn tó rò pa àwọn ti tó tán, á rẹ̀ wọ́n sílẹ̀. So, including menopause, it comes with its own challenge. Even pregnancy. Early morning sickness. Over meat. Peter lady my say, it comes with stresses. Ara wúwo kò lè gbé, wọ́n dẹ̀ ní ara ò lè wúwo, kálára má lè gbé, ó lè má lè gbé if it's exhausted. Lifestyle, poor diet. Ìgboro ti lè ìjẹkújẹ ló wá pọ̀. Ata gígún ló pọ̀ jù ń sìn. Tomato gbígbẹ. Òun náà fi sachet tomato support. Oyè tó kára òwò ti kára ẹ̀dẹ̀. Ibi gbogbo náà ti ń kẹ́dì yálẹ̀. Use of alcohol, àwa ọmọ tí o, àbá mu. Let it not be named once among us. Use of illicit drugs, stress, burnout, sedentary lifestyle. Joko. That's why I say whatever you are doing, always be on the move. Don't just sit down, sit. Even you are a trader, to joko to jepo wa fún ẹ lówó, stand up, move around. The more you move, you will beat stress, you will beat exhaustion, you will live longer. Ẹnìkan ní ma ti target ọkọ ẹ. We had a prayer summit for men 2 days ago on June 12th. And the assistant pastor in charge of region said the wife told them that Mommy Region led them to pray that their husband will not die, that even in the church there is somebody who is targeting their husband. You don't know it's true. They ask a sister, kí ló dé tí marry? Ọjọ́ tí ń lọ. He said, má worry. Pastor kan tó kú. Tó bá kú á dẹ̀ rohun. I'm standing on the altar. Ó ṣẹlẹ̀ ni. Nǹkan tá a mọ̀ la mọ̀. So what you have, you are better guided jealously. Medications can cause exhaustions, including benzodiazepines. Wọ́n fún Lexotan, wọ́n fún Valium. Òun fúnra rẹ̀ ló lọ ń dára tó ń dá lò ó. You can cause exhaustion. Antipsychotics, anxiolytic. Let me leave those drugs. We are not to talk about it. Next slide quickly. Medical conditions. HIV, COVID-19, influenza, common cold. All of them can cause it. Depression, anxiety. Other deficiencies, vitamin D, vitamin B12, they can cause it. Dehydration. You are not drinking enough water. You may become exhausted. Overweight. You have added so much weight. God has blessed you. Be careful. Next slide quickly. What then is anxiety? It's an emotion characterized by feeling of tension. Ara ò ní lélẹ̀. Somebody said, ara mi ò lélẹ̀. He knows, she knows, para òun ò lélẹ̀. Worried thought is bothered about everything. Kí làwọn ọmọ yìí máa ṣẹlẹ̀? Ṣé àwọn ọmọ yìí ó ní ìyá rẹ báyìí? Will this happen to this? Kí ló dé? Relax. God is in control. Maybe you don't know. 95%, in fact, some people say 99% of those things that we fear, will happen, don't happen. Ọmọ tó rò pé ó máa fẹ́ẹ̀lì kò ní fẹ́ẹ̀lì. Ọmọ tó rò pé ò ní rọ́kọ. Have you noticed pé tí ò fáyìn gan rọ́kọ jẹun tó fáyìn lọ? Ṣé ti rí náà? It is the spiritual that controls the physical. Have you not seen Miss Nigeria tí ò rọ́kọ? Tó dẹ̀ ń gbé fine girl kiri. Natural beauty kò tóònù kò fi nǹkan kan kún. Ọlọ́run dá ní pupa bẹ́ẹ̀ ni. Ó dẹ̀ ń runlé. Ó dẹ̀ di prayer city. Ó ń gba prayer city dé redemption camp lórí ọ̀rọ̀ ọkọ yìí náà. You will see some people say, eléyìí ò dẹ̀ fine o. Báwa ẹ wo ọkọ ẹ̀gán tó fine jù lọ. Àṣeyẹ òun lọ lọ́rùn wa. Ẹ pàtẹ́wọ́ fún Jésù mi. Don't bother yourself. Ẹlẹ́dẹ̀ àdọ́yọ̀. Ariwo ló máa pọ̀. Wherever you will get to in life, you will get there. Provided you are still on his side. Tó o fi Jésù lẹ̀. If Jesus is still with you. So some symptoms include restlessness, uncontrollable feeling of worry, increased irritability, difficulty concentrating, and sleep difficulty. If you're anxious, you can't sleep. Have you noticed it? If you travel regularly and you have a good home that you are looking forward to going back, the last night that you are going to the airport, it's normal anxiety. There are things that are normal. This child is going for an interview. You are praying along. You may not sleep well. They are normal. There is generalized anxiety disorder in which many people, they have all these symptoms. And when it is too much and is there every time, it is a disorder. It becomes a problem, especially when it now begins to affect your life. There's also people who have panic disorder. Brief. You will just have this anxiety briefly. Bam! And the thing comes and goes and it's coming repeatedly. That is panic disorder. And it's also specific phobias. Some people cannot stand and speak. Some people are afraid of closed space, open space. And they have a phobia. If they are alone in an elevator, anxiety, anxiety, anxiety. Next slide quickly. What are the causes? Environmental causes. Family problem. Ìlú yìí ò rọgbọ mọ́ lọ sójú títì ogunlọ́gọ̀ ló fajúro. It will cause it. Environmental problem. Ibi tá fojú sí tọ́nà ò gbabẹ̀. Promise and fail. Tá fọkàn sọ́dọ̀ Ọlọ́run. Tá fi ẹran ara ṣe ìgbẹ́kẹ̀lé. Mo sọ Yorùbá kó lè yé wa. There are relationship issues. It can cause anxiety, stress, exhaustion. Genetic predisposition. There are some family around one. You see that you have a bit of this from mommy, a bit of this from daddy, and we know. And when you notice it, that other power, you must consciously try to slow down. Consciously, you do something about it. Medical factors. Side effects of some medications can cause it. Comorbidity, depression. Next slide quickly. Environment, people. Why will women have increased risk of anxiety? One, hormones. You have a lot of estrogen that goes down perimenopause and after menopause. The mood changes. They become easily irritable. They have hot flushes. It could cause exhaustion. It could cause anxiety. Difference in coping style. Women are more likely to ruminate. He will be repeating and thinking and thinking and thinking. A man may say, he will carry it and put it on the side and goes away. He may come back to meet later. But women tend to ruminate over and over and over and over. It makes them predisposed to anxiety. Connection between anxiety and emotional abuse. The home front is not okay. Domestic violence. We're slapping you, you are replying, and the children are raw and watching. There's a classmate of mine who is well over 50, who is still single. And I said, why? He's been in America. I said, why? When are you going to settle down? How much you in university? In fact, one of my classmates immediately passed in, Maiwa Olabi. The doctor. Yet, this one is still single, because he married. He looked at me and said, Semo, you don't understand. And I said, why? What don't I understand? Look at this story. He said he grew up seeing daddy and mommy fighting. That daddy is a typical Ondo man, to lagidi. I'm quoting him verbatim. But they are staunch Catholic. That's why they remain together. God hates divorce. Malachi 2:16. That's why the woman is pashing up. But do you know the multiplier effect? Even the elder sister that is older than him is also still single. I'm telling you. If you see him, fine boy, no pimples, only natural curly hair. But he's still single. It's practiced in America, it's practiced in Nigeria. As I speak now, it may not even be in Nigeria. I'm about rounding up, don't worry. How many minutes there? I'm conscious of time. I have 2 slides or so more. Care and treatment. Find out the cause of this exhaustion. History taking, physical examination, lab tests. We need to do physical examination. If somebody has slapped you, the doctor will see signs of abuse. If they ask you, "Shonk ba eleti ni," admit you shonk ba eleti. Ọ̀rọ̀ ń tóbi ká fọ̀bẹ bù. À ń sọ bẹ́ẹ̀ ká kú bẹ́ẹ̀. Ẹnu la máa fi sọ. Yes. Let them know. Run to daddy. Run to mommy. Don't wait till it comes out of place to Madi Ronto. So, go back. Yes. Treat any underlying cause. Practice good sleep habits. Look, if we attend vigil and we come back from vigil, if you don't wake my wife, always on the 12 noon. Do you know the more you sleep, especially to manage stress, the less malaria you will have? You don't know. Because your immunity becomes stronger. Avoid alcohol, manage stress, meditation, regular exercise. See your healthcare provider. Let the doctor help you. Reach and maintain a healthy weight. Yes, next slide now. Yes. Take time out. Tell your neighbor, relax. Take time out. Teach those children to help you. Even they are female who don't know how to cook. You have teenage girls, you have teenage boys, you are still in the kitchen cooking. You should just supervise them. Take time out. Give yourself a break. If you don't rest, they will lay you to rest. Tọkùnrin bá lọ́dún kan kó tó rí màrí, ó gbìyànjú ni. Wọ́n ń pẹ́ o. Even ní ṣọ́ọ̀ṣì wọ́n máa sọ fún pé, ó máa lè dá ayé ẹ gbé. Ayé ò máa dẹ̀ ṣe é gbé. Ṣé rùngbọ̀n ló fẹ́ máa kó náà gí? Sincerely, even pastors in Redeem, I can tell you, kì í pẹ́. Àwọn mi ò pọ́dún kan. Àmọ́ Mary John was asking me pé, ṣé ìyẹn ọkùnrin iṣẹ́ ẹ̀ fẹ́ràn wa ni? Téèyàn kú tẹ̀dẹ̀ márùn wọn yà mọ́ ni. Èmi ò mọ àwọn ní kẹ́ bèrè lọ́wọ́ wọn kán dáhùn ẹ̀ o. I can't hold brief for men. I can only speak for myself. Get enough sleep. Learn about triggers. What is making you not to rest? Do something about it. Ṣọ́rọ̀ ọmọ ni. Tàbá kó àwọn ọmọ yẹn àgbáyé o. Have you noticed it? God has a purpose for every child. Answer kiri, lori omo. If you die, those children will live their life. I can tell you. You have a typical example. My sister-in-law, she died shortly after delivery and had a baby girl. For 6 months, the baby girl was with my late mother-in-law, who died at 88. She wasn't hypertensive. She wasn't diabetic. She was 48 when the husband died at 49. So for over 40 years, single-handedly raised up 7 kids. My wife is the baby of the house. My wife will be 53. But that's not the story. She took over that baby for 6 months. Unfortunately, my sister-in-law who is 60 today had secondary infertility. There was 12 years gap between the son and the daughter. So in the interim, she took this baby from grandma. This baby, we are waiting for her to marry. She has gone to school. She's well adjusted. She had lived with this daddy and mommy. I will say, Daddy Teko is your second daddy. Your first daddy is in Ijebu-Ode. Do you understand? This baby, I think she'll be 26 or 27 or thereabout. Nobody will say she should not marry. And I'm coasting home. So, delegate duties but not responsibility. Ask them to help you do it, but make sure that there is the person who can do it that you are giving it to, so that you can go to sleep. Don't be sweeping in the house when there are children there. Don't say they won't do it where. If you don't teach them and they don't practice it, they will not know how to do it. Yes. Let her add salt and let it be too much and say, what that way your to next time, reduce here. In the process, you will teach them. Train your children, irrespective of the gender. I cook more than my wife. If my children comes in, they will say, daddy, you have cooked something. I'll say, yes, I've cooked something. We are telling men that there's nothing that says a man must not come to the kitchen. I'm not talking about those who were born in the 60s, 70s. Primary school. Maybe that's what helped me. You know, grew up in face me, I slap you setting in Lagos. So, when to call a doctor, when you suddenly notice that you're having shortness of breath, call a doctor or rush to the hospital. You can't see well. Don't wait till you fall down. You are having nausea and vomiting, you feel like vomiting, muscle weakness, thought of harming yourself. Finally, is the last slide now, I think so. Next slide quickly, I'm rounding off. Learn problem-solving skills. Focus on important tasks first and manage your time. Delegate as appropriate. Learn to rest. Let's land with the scripture. Oh yeah, next one. I see God single you out for a special favor. Think about this. Isaiah 62:1. For Zion's sake, I will not hold my peace. Put your name for Zion there. For Sunday Amosun's sake, I will not hold my peace. And for Sunday Amosun's sake, I will not rest until our righteousness goes forth as brightness and as salvation as a lamp that burns. God bless you. Thank you very much.